In this video we're looking at respiratory infections in children, the course they normally run, what you can do to help, and when you should be concerned. The first thing to say is that respiratory illness in children is very common, especially in that first year or two of life when they're building up their immunity and when they're starting nursery or school, when children mingle together and pass infections from one to the other. Having 6 infections a year is quite normal. And because they can last 2 or 3 weeks at a time, and one can merge straight into the next one, you can sometimes see that the children are ill for weeks on end. This in itself isn't a concern and is quite normal. What are the symptoms of respiratory illness? Well, we're talking about blocked nose, runny nose, sore throat, hoarse voice, cough, perhaps glands swelling in the neck, and sometimes fever. The natural course of these illnesses is that they build up for the first few days, reach a peak at about day 3, 4 or 5, then gradually as the immune system kicks in and starts to battle the infection off, they gradually get better, although it may take 2 or 3 weeks to shake the thing off altogether. So don't expect recovery too soon. What can you do to help? Well, there are some simple things that you can do to start with. For the little ones, it's very important to keep breastfeeding if you are breastfeeding, because breast milk contains lots of components that help fight infection. It's important to keep your child hydrated by encouraging them to drink plenty of fluids, because it's when they get dehydrated they can start to feel really unwell. Medicines can help. For instance, paracetamol is good if a child is in discomfort or is distressed by a high fever. Giving paracetamol 4 times a day for several days is quite safe. Finding a medication to help cough is a little bit harder. We think that mixing some honey, some runny honey, with some lemon juice and perhaps a little bit of water will give you a cough mixture which is good as anything else that you can find anywhere. When should you be concerned? Well, the sign which makes us most concerned about serious respiratory illness is rapid breathing. You might notice that your child breathes faster than they normally do. This is a concern. You should remember though that a child who is distressed or has a fever will breathe more rapidly than normal anyway. So you must only make this assessment when the child doesn't have a fever and isn't distressed. Then you can listen to the sound of the breathing. If the child is wheezing, in other words, making a whistling noise when they breathe out, this can be a sign that the airways are tight, and this can be a concern. Or sometimes you hear a child making a very harsh noise when they breathe in. We call this stridor, and it can be a sign of tightness in the back of the throat. This again is a concern. Then you can look at the child's general state of well-being, particularly looking at their fluid intake. Now, it's quite normal for a child with a respiratory infection to go off their food, and it's quite normal for them to drink less as well. But they should drink at least half of what they normally drink. If they drink less than half of their normal intake, that's a concern. Sometimes it's hard to work out how much they are drinking, especially if they're breastfeeding, for instance. In which case, it can be useful then to look at the amount of urine they put out. Again, we'd expect a child to go for a wee about half as much as they would normally, at least half as much. Less than that is a concern. For a child in nappies, you can make a judgment on this by looking at how many wet nappies they have a day. We'd expect a child would normally have 3 or 4 wet nappies every day. Any less than that, and we're concerned. Then you can look at the child's state of alertness. A child may often sleep a little bit more if they have a respiratory infection. That's quite normal. But they should be rousable. And when they are awake, they should be focused on you and be able to interact with you. If they don't and appear to be drowsy, that's a cause for concern. If you do have any of these concerns, then you should contact some help. At Seymour Medical Practice, we have a triage system, so we'll talk to anybody who's concerned about a child on the same day. We try and prioritise children's healthcare, and so we try and deal with these calls especially urgently. Outside of normal working hours, you can call 111, and there you'll get some advice and we'll be put in touch with a medical professional if it's needed. You can find out more about accessing health services on our other video link called Accessing Healthcare. Finally, I would like to remind you that vaccination is one very important way that you can prevent some of the most serious respiratory illnesses in children. So it's very important to keep your child up to date with vaccinations, particularly in that first few months when they're at their most vulnerable. I hope you've found this video helpful.